I had a phone call with the Department of Public Health, and I wanted to share what that was like. So they called and asked for me and verified my name, my birthday, and the fact that I had tested positive for COVID. And then she said she wanted to talk to me about um, contact tracing and about quarantine and isolation and about my symptoms. So, first, we discussed where I had been 10 days prior to my symptoms beginning and 2 days prior to my symptoms beginning. Because within the 10 days prior, that's probably when I got exposed. And then 2 days before my symptoms started showing up, that's when I began to be contagious. So we talked about various events. She's, asked if I had been to any sporting events or large gatherings, and I had been to a small, like, middle school basketball game and a wrestling meet, and church. Those were the three things. We don't know where I got exposed, but we do know that it's spreading around our community like wildfire. And anyway, so that's a mystery. I don't know exactly how I got COVID, but I do know that there are people in my community that have it. So that was the first thing. And then we talked about if I was around any people for longer than 15 minutes within 6 feet, for those 2 days before my symptoms started or after the symptoms started. And I could just think of like one person in my yoga class, and then like my family, because once symptoms started, I stayed at home. Anyway, so that was the conversation we had about kind of contact and like exposure, and then we talked about like the dates when my symptoms began and when I got tested, and then sort of the timeline of how long you should isolate. She recommended isolating for 5 days from the onset of symptoms, and even like more than just quarantining at home, but isolating from the other people who live in my household. And my results came in 6 days after my symptoms started, and then my this contract tracing phone call was like 10 days after. So at this point, it was too late for me to isolate from the rest of my family. But thankfully, I had quarantined at home for the duration of my illness. Okay, so then after we talked about sort of the isolation and quarantine, she asked me about my symptoms and also about health conditions. So it was basically just a yes or no. Do you have heart problems? Do you have diabetes? Do you have this, hypertension? Do you have any of these list of sort of underlying health conditions, or illnesses or chronic problems with health? And I answered yes or no to those. And then she asked about specific symptoms for COVID, and I answered yes or no to all of the symptoms. And then she asked if there were any other symptoms that hadn't been discussed yet, and I was like, yeah, I got really sweaty at night, and I was irritable, and there were a couple of symptoms that weren't on there. But anyway, so we went through all the symptoms, and then she asked if I had any questions, and made sure that I knew how to contact them, and that was that. So I just thought it'd be an interesting discussion just for you to know what it's like when the public health department calls to talk to you about COVID. Those are the things that they want to know.